We turn now to the coronavirus pandemic. The Delta variant is fueling a rise in cases in more than a dozen U.S. states. President Biden addressed the nation on Tuesday, saying the, quote, best defense against the variants is vaccines. The U.S. fell short of its 4th of July goal to get 70% of adults at least partially vaccinated. He's now urging everyone who can to roll up their sleeves. Weijia Jiang has more.
Tonight, a new warning from President Biden about the COVID-19 Delta variant after meeting with top health officials.
We discussed how the Delta variant is already responsible for half of all cases in many parts of this country. It's more easily transmissible, potentially more dangerous.
The number of cases across the country is up by 9%, and several states are seeing a dramatic surge. Arkansas is now averaging 475 new cases a day compared to 142 a month ago. In Missouri, 861 people are testing positive, up from 396. And in Nevada, there are 449 new cases, more than double the 204 in June. Most of the states with spikes also have vaccination rates that are lower than the nationwide average.
Millions of Americans are still unvaccinated and unprotected. And because of that, their communities are at risk.
The president said the administration would continue door-to-door outreach in local communities hesitant to get vaccinated and also provide more doses to schools and workplaces. But some people who have access to the vaccine still don't want it.
Is the White House tweaking its strategy to reach those people, to change their minds?
I wouldn't say it's about changing their minds. What we have seen over the course of time is that the most reliable voices are trusted actors in communities, medical experts.
Top health experts say holdouts are taking a big gamble with their lives.
Right now, if you're unvaccinated and you've not previously gotten COVID and recovered, you should anticipate that you will get COVID this summer from the Delta variant.
Vaccine experts note that the states with lagging vaccination rates and high case numbers are mostly red states. The White House is sending surge response teams to those areas to work with local leaders on, among many things, the politics around getting a shot. Caitlin?
Weijia Jiang, thank you. For more, let's bring in Dr. Jeremy Faust. He's attending physician at Bringham and Women's Hospital Department of Emergency Medicine and an instructor at Harvard Medical School. Dr. Faust, thank you so much for being with us. I appreciate your time. So President Biden has urged Americans to get vaccinated. He said that it's, quote, a patriotic thing to do. More than 47% of the population is now fully protected. So remind us, why is it important to get vaccinated right now?
Thanks for having me. The reason to get vaccinated now is to protect yourself and to protect others. So often during the coronavirus crisis, we've been asked to do things for other people, stay home and avoid things. But when we had a selfish conflict, should I do something for me or for the community? Sometimes people were confused as to what to do. This is an example where it's a win-win. You're doing something for yourself because it eliminates the chance of being hospitalized or almost completely, and you're doing something for the community because you're actually stopping spread. That is the key message, is we can't afford to spread this virus.
Good message for those still vaccine hesitant. The president also outlined several ways the administration is trying to get more people vaccinated, and they include a more targeted community approach, targeted community outreach, and trying to get vaccines into offices of healthcare providers. I'm curious what you think. Do you believe the administration's strategy will be enough to boost these vaccinations?
It's the next move that has to be taken. I think that these large-scale stadium-style mass vaccinations were a great thing to do for the people who really were eager to get there. But now we have the next group, which are people who aren't quite so eager. And so one of the reasons that people will say they haven't gotten vaccinated is access. And so let's eliminate that problem. Let's go to where the people are. And for people who are on the fence, they're not going to drive 30 minutes for something they're not sure about or that they aren't sure their neighbors are going to do. But if they see that in their workplace or their neighbors are literally getting vaccinated right in front of them, and they think, well, if they're doing it and it's right here, why not? We're not going to get everyone in that way, but we're going to get so many more people. And right now, it's sort of a game of inches. Every percentage has a life saved associated with that. So the number goes up 2%, vaccinated a few more percent, a few less people die. That is how we're going to play this out.
So a shift to kind of a more hyper-local approach there. And as we just saw, the cases in the U.S. are up nearly 10%, and that's largely due to that Delta variant that we've all been talking about. So how much worse could this actually get, and are you concerned?
I am the most concerned about places that were mentioned in the segment, the places with low vaccination rates, because Delta is not necessarily causing an order of magnitude worse disease, but it is so much more contagious, so it can really rip through a community quickly. So I'm very focused on getting the places where we have not yet seen a majority of adults get vaccinated, getting across to that 60, 70, 80% vaccination rate. In places where with high vaccination rates, I think we will see cases go up. We're seeing that in Israel, for example, but I think so far we've yet to see a major spike in hospitalizations. That just reaffirms to me how fortunate we are about these vaccines. The vaccine is so good that even when the virus mutates, it can maybe sneak through and cause some more infections, but it really hasn't yet shown that it causes a spike in hospitalizations. And it's a spike in hospitalizations and deaths that really is an existential threat to how we live our daily lives. If we're just getting infections and no one's really getting sick, that's okay. That's the vaccine doing its job.
Good reminder why you should still get that vaccine if you haven't already. So critical. Experts are also now raising concerns about the Lambda variant. It was first discovered in Peru last year, and the World Health Organization says that it could be even more transmissible. So do you know what we've learned about this particular strain? And is this one potentially, could it evade vaccine protection?
We are just learning about this. So far, what we know is that it's the dominant mutant in certain areas of the world, and that tells us that it's probably quite contagious because it's outcompeting other versions of the coronavirus. We will certainly hear in the coming weeks about the vaccine evasion. So far, with every variant we've had, we have alpha, beta, we've heard of delta, all these different vaccine variants, viral variants, that it seems that the vaccine still protects against the thing that matters most, which is severe disease and getting to the hospital, to that level of sickness. So my guess is that we'll see maybe the same thing again, which is that, in a lab petri dish environment, the virus is a little bit able to squiggle away its way away from those antibodies that the vaccine gives us, but not so much that it actually causes a problem. That's my hope, because that's what's happened so far with the other variants, and I expect the science community to test that very, very soon.
All right, still so many questions from this pandemic, but thank you so much for helping to answer some of them. Dr. Jeremy Faust, we appreciate your time.
Thank you.